Welcome to my podcast, Magic Brain Geeks. My name is Maria Hoffacker and I am the host of this podcast, and I'm a biologist and an expert in applied neuroscience. And today I have, two special guests because it's Hyunju Kim and Ayan Paul again. And we had nearly 1 year ago an inspiring podcast interview about the question, what is intelligence? And Hyunju and Ayan shared some of their amazing research results. For those who are interested in listening to this podcast episode, it is podcast number 14. Yes, and now both of them started new research and studies about a very current topic. It's about the mitigation of viruses and especially about automatic contact tracing and the game of big numbers, they call it, in time of COVID-19. And of course, I'm very curious to hear about the new research and the first results. Welcome. Yes, Hyunju and Ayan again. And I would like to ask you if you can introduce yourself, and then we go into the topic, of course. Hyunju, would you like to start?
Yes, I'm a theoretical physicist by training, and I'm a network scientist. I'm working as a research assistant professor in the Arizona State University in the US. My main focus is looking for universal principles underlying biological systems, and I'm currently interested in how to interpret and understand human behavior at large scale, especially related to current spreading of a virus.
Mm-hmm. Wow, thank you. And Ayan?
So I also happen to do a bunch of different things. My primary training is in theoretical particle physics. I work at DESY. I'm a fellow there. And so in the past couple of years, I've been diversifying my portfolio. As Maria already mentioned, we started some work on intelligence, which we unfortunately had to put to some halt because we started working on more relevant topics for the current situation. And we started working on COVID-19 and related data. We also started doing some theoretical modeling about disease spread. We started looking at various ways of understanding how to mitigate the disease. One of them is automated contact tracing. And so we have a research group working around that. We will discuss it soon. And in addition, I also started looking into making an app which will be used for COVID-19 mitigation, which is supported by DESY. And we are now building the app, and we are finalizing its rollout for March.
Wow, sounds totally interesting. And of course, I want to learn more because everybody, we are all, in this pandemic, and we all look not to get or this wonderful virus, wonderful in, of course, not so really. And of course, it's wonderful if we can learn something about the mitigation, and perhaps we can have some tasks or possibilities to how we can manage ourselves and how we can manage our contacts and everything. Could you say how you start with this new research? What was the motivation and what was the beginning of this research?
So let's say around March or so, Hyunju and I, we were discussing what could be done. And Hyunju's work is more related to the kind of things we are doing now. My work, which is particle physics, is quite far away. So she basically had more of the expertise than I did on how to do all of these. And she was more connected with what was being done out there and where we could actually put our fingers in. And one of the things we saw is there was an MIT hackathon online, which I decided to participate in, and I met some people there, formed a team. We were trying to address assessment of immunity and risk to COVID-19. And in that discussion, we came up with some ideas which later led to the app. We will discuss that later. But in all of those discussions, we started looking at automated contact tracing. And because that was a fresh idea at that time, this is beginning of April. And automated contact tracing was supposed to be rolled out on the 15th of May by Apple and Google. A very fresh idea. It was highly hyped in the scientific literature. We read a lot about it in the literature, and everyone was very happy that it would work. And it's an automatic extension, right? Contact tracing has been used for a very long time, and it's been used for many different diseases. And it has worked. It has worked for MERS. It has worked for SARS. It has worked for other diseases which are communicable. So the automatic reaction was that if you can, these manual ways of contact tracing, if this could be automated, it would be faster and it would be more far reaching, and hence it could contain the pandemic. That was basically the idea. And we were really trying to explore whether this is applicable at the real scale. Because one thing is an idea, the other thing is implementing it at real scales. Yes. Manual contact tracing is somewhat easier to implement because what you do is you talk to the people who are infected and you try to see who they came in contact with and then contact them manually and etc. And you follow the chain. And that's a manual procedure, whereas an automatic procedure would be have a device do that.
Right? Yes, so, because of course we all or mostly we have this COVID app with this automatic tracing, I would say, but it's voluntary, of course, no? And yes. It depends on the human behavior, at least, no? To use the mobile device and to use this app. What is the experience about this, human factor, I would call it, in this app? Is there do we have any research or results about that? Is it working?
So the human factor, actually, we took that into account in our research. And that is what the entire research is about. So we can start digging into that right now. Because unfortunately, our results were negative. So,
okay.
And negative in the sense that it's not like it was, we didn't get any results. We got results, but they were not good results.
Okay.
So after all this hype with contact tracing, we decided to see that how many people are actually required to make this work. What is really necessary for the automated contact tracing to work is people should use it. Now, the big question is how many people need to use it, because no one can force people to use it. It's if you do it on a voluntary basis, then no one can really force people to use it. So then you really have to understand, suppose someone is walking in a crowd, and others are around them. Then if the person is infected, the other person's device has to know that. And for that, the other person actually has to use the automated contact tracing, right? So these both people have to have the same app. And these apps have to collaborate. So then you crunch some numbers and you realize there are certain factors which come in. The first factor which comes in is that not everyone might use the app. Right? Second factor might come in is that, which is specific for COVID-19, is that not everyone who is carrying the disease might actually know that they are carrying the disease. The third factor which might come in is that people might test positive but not tell others, which was a thing in Germany because about 50% of the population, 50% of the users were not reporting it, that they've been tested positive, approximately. And then there is always the factor of what fraction actually needs to be quarantined to actually stop the disease. And that's a very large number in COVID-19 because it's so contagious. So if you put all of that together, then you quickly realize that the number that is necessary to stop the disease is very large. And the fractions that we were seeing, the fractions of users that were necessary to do this was about 40-50% in the best case scenario, 40-50% of the population. And maybe even more, 60%, 70%, depending on how many people were actually reporting it, etc. And if you look at these numbers, then it becomes obvious that at the real scale, it is very difficult to implement this, right? Because if you look at the number of cell phone users, it's about 80% in the United States, about 70% in Germany, smartphone users. And that is, and expecting that almost all of them use this app is a no-go. We also showed that it actually scales as the square of the number of users or fraction of users, which means that if 16% use it, only 4% will be traced. So it's
a big difference.
Yes.
Okay.
So, and since there is this scaling by the square, you really need a large number to actually cover how many you try to trace. And the thing about our formalism is we made it in a very simple manner. We didn't do any complicated modeling. This was just a statistical analysis, depending on probabilities. And really, it was kind of, it was a very quick analysis, true, but it was also something which got validated very quickly. Because we, in May, June, July, and in the subsequent months, many countries actually released contact tracing apps. And it was clearly seen that it wasn't really adopted so well, right? And since it wasn't adopted so well, not many people were warned. And just from the numbers, you can understand that the scaling rules apply. And that is what actually killed automated contact tracing. If it was not voluntary, maybe not. It would still live.
Oh, I see. Okay.
So
that sounds, of course, not so good. And do you find any solutions for that? Is there possible to add some HI or medicine literature or something to the app, or is it the other way around, that you have to take in account that it is an app that everybody has to use or something like that?
Well, it can work. Like in South Korea, in countries like South Korea, contact tracing worked quite well.
But the point is that in South Korea, it's not really automated contact tracing. It's a mixture of automated contact tracing and manual contact tracing. And that too combined with the mandatory participation. And in the case of South Korea and a few other countries in Asia where the contact tracing worked really well in the beginning of this pandemic, they used many other automated data, not automated contact tracing, including CCTV footage and GPS information, credit card information. And this might be considered too much private privacy encroaching in some other societies.
Yeah, I see.
That is why automated contact tracing is really highlighted as a substitute in the other societies, so where this privacy is really more valued. So to make the automated contact tracing, it's not just a technological problem. We need really policy changing. We need really changes in policy and changes in the people's perception and more agreement about how much we can share for the community health. Yeah. And how much what is the limit, and what is how much we need to protect our privacy, because in the countries where this mandatory contact tracing is used, they also have the policies and the laws to protect the privacy, even though sharing some information is mandatory.
Mm-hmm. Okay, it's mandatory and working, and of course it's better at the end for the health of everyone, so that you have a mandatory side on the one hand, but also yes, some protection for the personal data. Is this right? Did I understand it right?
Yes. So yeah, that's my opinion. That we need really support from the policy and the community agreement.
Okay, and then it's working, and it's of course a good instrument so that the virus cannot spread like it does in January, for example, here in Europe. Yes.
Yes, it's automated contact tracing can be made to work if certain issues are addressed. Hopefully there won't be another pandemic anytime soon once this is over, but suppose in the future we need this technology again, it can work. There are many ways of actually protecting user data and not trying to distribute it, or making systems which are inherently encrypted and do not require centralization. And these are considerations that should be taken into account. And if these are taken into account, if the device itself is made more accessible, a smartphone, okay, it's a smartphone, but you have to keep your Bluetooth on, which means it is consuming battery and etc. Whereas micro Bluetooth chips, which consume much less battery, which can just be dropped into your pocket or carried around with you in your, let's say, wallet or something. These things can later come into play as electronic devices get smaller and smaller. And these can actually help in decentralizing automated contact tracing and making it privacy safe for everyone while helping the society. And as Hyunju said, it's also a mindset change that is necessary, because most of us have never gone through such a serious pandemic.
Yeah.
But as we see what damages it does, many people are willing to make changes in their lifestyle. And this might ultimately contribute to such methods actually working.
Yeah, okay. And you mentioned that you are in work to apply a new app as a back, I think it was with DESY and some companies behind. And what is the difference to the normal, I think, we used app and this new one?
So we realized that contact tracing won't really work.
Yeah.
However, what always works is if you give people information in a way that they are allowed to choose what they want to absorb, they tend to educate themselves. And then they know better, they can make better decisions. While this does not guarantee that everything will go well, it does, in a certain way, guarantee that things will get better. Because more people know how to deal with these things, the better it is for their lives and the better it is for the disease mitigation. So we started working on a concept where we would deliver information to the users. We would tell them that if they go to certain places, there are higher risks. If they go out very often, there are higher risks. These are things that people already know. However, seeing it on the app is somewhat different. Like, you know what the weather is like outside. You look outside and it's fine. But you still have an app which tells you the temperature so that you get some kind of a measure of what this is, right? So if we could provide a measure of how much risk people are taking, that could be something that people could relate to. And that could be something which would inform them whether what they're doing is good or bad, or just like you decide whether to wear a jacket, you could decide, okay, today I will not go to the restaurants because the risks seem to be high. And this is what we are trying to deliver with this app, using some predictive algorithms based on AI, and using medical data from medical literature. There's a lot of medical literature now that requires curation. And we also use user data, but we are adopting a federated model for computation, in which case all the computation for the user data is done on the phone. All the user data is stored on the phone, whereas we send all the data from the server to the phone. So we don't take anything back from the phone. If people want to store their details, there is an option. But in general, we don't want their data. We don't really need it. So we send the information and it gets processed on the phone. And this was quite challenging because then the system has to be made very efficient. We don't want to eat the phone's battery all day. So
I see. Yes. Yeah. So it is an education app, and something like I want to go, for example, in the grocery store, there is my risk is, I would say 40% perhaps. And now I go for a walk in a forest or something, then it is 10 or 5 or something like that.
yes,
In this area, so that and of course you can protect your data, and GPS is working, of course, or do you say, okay, I want to go there and I check what is the risk situation currently there?
No, we don't have that feature as yet, as to check what the risk will be if you go somewhere, because that is Google makes it really expensive to do that, and we didn't want to do it in the beginning.
Okay, I see.
So what we do have is, if you go somewhere, you get to know how much risk you're facing. If you're sitting at a restaurant or something, again, this is all in the context of what the disease spread is like, right? Because if there is no disease spread in your area, let's say there's not that many cases in your area, going to a restaurant is perfectly safe. However, if there's a lot of infection in your area, typically that's taken about 50 cases per 100,000 people per week. Then going to such places is more risky. And imagine, of course, there are many people who read the newspaper, who keep track of this. But if you have such information in your hands telling you that, look, the risks are going up higher in your area, we do have charts and plots which show how the risk is going to be in the next 7 days. in your area. And if you get all of these information, then you can act upon it. You can decide what to do. You can plan or cancel a visit to your, let's say, family who's living in another city or things like that. It's just trying to give them extra information.
Mm-hmm. Yeah, it sounds good. And the data for this information you have already, or is it a continuing databases because of everybody is learning through this pandemic? No? We are, of course, knew more than 1 year ago, but of course we all have, some spaces where we don't know how the virus is working or how he mutate or something like that.
Mm-hmm.
Therefore, you continue collecting data?
So there's reliable sources of public data on how the disease is spreading. One is, of course, the RKI has its database. Then the Johns Hopkins University collects data for the United States. And we are covering only Germany and United States for now. So, and we can use that data, and that is how we predict what the disease spread is going to be like. And secondly, that is a constant data stream. The second part is medical literature, and that keeps changing. Because if you're of a certain age with a certain underlying condition, you have a certain amount of risk. And these numbers are evolving as the disease progresses, or a different strain might come, and that different strain might start affecting the younger people too, and then their risks go up. So these have to be continuously kept track of. And these are things that we can change. And we have built the system such that these changes can be made very quickly and deployed very quickly. So if today I get a new number, by tomorrow morning, it's on your phone. So it's not like we have to wait for an update in another 2 weeks no, we didn't go into that route. It gets deployed immediately.
Okay. Yeah.
So that's basically how we want to keep people informed.
Yeah, that sounds good. And of course, many people are scared. And then when they have data or be more informed, then it's perhaps possible, although on the psychological way or to have a different mindset, no? to handle this pandemic, because it's very hard for everybody we know to handle all these circumstances in this pandemic. What do you think is the most helpful things, depending on your research, what would help people the most? The change mindset, this contact tracing, or be informed, or what do you suggest? What is, or when you have to give an advice for the normal people? Difficult question. Yes, of course. Perhaps you have one from your own experience.
I mean, from the scientific perspective, I think it's very complicated to actually give a concrete set of guidelines. We leave that for government policymakers. The pandemic is continuing to spread. And there hasn't been anything that has been effective against it other than closing down economies. And that has affected everyone. Whether it be because you cannot go out, whether it be for some other reason, for people losing jobs, etc. So that is another area of research we are exploring. So Hyunju's expertise is networks modeling. So bless you.
Thank you.
Bless you.
And that's another field we can explore as to see how the disease can be slowed down without affecting the economy so much. Because what we saw last year was essentially a knee-jerk reaction, where everything was suddenly closed down and then things were opened up again suddenly, and there was no coordination, or there was no reason why things were being done. People were just guessing it. And so we are working on another project where we are looking at how this can be done better and how this can be coordinated so that while we are slowing down the disease spread, the economy doesn't get affected so badly. It's not an easy work, and many people are trying to understand this. And the biggest problem is that no one really has thought about these things before. And so even data about these things are not so freely available.
Oh, I see. Yes.
So it's difficult, but we have got a grant from Volkswagen Stiftung to work on this, and we intend to see what guidelines we can come up with, if any, in these directions. As for the other directions, I guess the government has already proclaimed that people should wear masks, maintain hygiene, and try to minimize socializing. I mean, that is the only way to stop, or the best way to stop a communicable disease.
Yeah, I see. Yes. Yes, and but of course, the network patterns, as Hyunju is working on, is of course although yes, a possibility, to learn about how we contacting and how the pattern works. This is also a way to learn more about, yes, how to handle the disease.
Yes, basically the virus is spread. It gets spread out by human. Right, by human context. So we really need to understand how human interaction works in a with such interruptions at the larger scale. The point is not the understanding how disease is spread out between two individuals important, and understanding the genetic information, everything is important. But also we really need to understand how this when the number of people we need to consider is large, like billions. And in that sense, we really need to understand the complex systems and how human behavior at the systemic level and the scientific and rigorous, with the scientific and rigorous method. And from the research we have done and by others, what we really need to understand is that there is no one silver bullet for this type of disasters, whether it's just this pandemic or future pandemic. We need the time to understand the nature of this new disease, and then while we acquire the knowledge, we need to really cooperate as the one society, and to find the best solution and to minimize the spread of disease and other damages. Then we need to do so. We need to find the optimum solution. And before this pandemic, until Spanish flu, we didn't really have this type of large big data information. But since we have that now, I think we need to really study how to use this information to prevent bigger damage. And I think what we are doing is the part of those types of efforts. So this actually is the really new types of studies, because we never had this kind of data when we had the pandemics.
Okay. Therefore, the pandemic is first is offering this data. It's a little bit paradoxal, but it is first time that we have or we can get this one. Also about the patterns, about communication, and yes, of course, a factor of how we as humans interact and communicate, and then of course spread. Because all this was not. Yes, now there are no reason to develop or to have research on that. Is this right? Yes, so the pandemic is a reason to research or to have some more results and more data about all these patterns. Yeah.
Yes, in a way, that's true. The thing is, before this pandemic happened, anyone could have modeled this in any way they wanted, but there would be no validation of whether their modeling is correct or not. Now that we have the data, we can actually validate models. I mean, there's a difference between imagination and reality. What without data, science is imagination. So to make it reality, we have this data now, and it's something of this sort. It's not, what we are learning is not only about COVID-19, it's about any communicable disease which spreads with a similar pattern, right? If you know Newton's laws, you can build any bridge theoretically. The effort required is different. It's similar for COVID-19. So in the future, if further communicable diseases come up, this is going to be we will have validated models of human interactions which can be put into use. And this is basically the purpose. Of course, for us scientists, anything new is fascinating. And anything which can be validated is even more fascinating. But beyond just the love of science, it is also the fact that what we think and what we do can be applied in the immediate future, which is not always the case for fundamental sciences. For the kind of science I do, I think I mentioned it earlier, it takes 50 years or 100 years to be applicable to the human society. However, what I found quite exciting about the science that I've been doing recently is that it can be validated almost immediately, and it can find use almost immediately.
Yes. And when you have a view to the future, what do you think is the most applicable, or what can you put in practice from your research, from these validate data? What is the first practical things that we can do for this year, or to give this pandemic an end? Of course, it's a future view, but what would you say from the scientific point of view?
The first application of our paper was probably the app itself, because in the time when we were actually considering contact tracing ourselves, we realized that it won't work. And imagine the governments cannot make it work because just 10%, 15% are enrolling. A small app made by a small company or by a small team would barely get 0.1% of the population. So we quickly realized that model wouldn't work, and we moved to a different model. And that, I would say, is a direct application of our work, because if we hadn't crunched the numbers, we would be still trying to do automated contact tracing and make that work. So, but now we know that we can do things differently and help people at the same time. And we have made this app in a way that it can be used along with the Corona Warn app. You don't have it, there will be no conflicts. You can use both if you want. Besides that, the immediate effects of our research is that we are there is another work which I had completed with some other collaborators, which highlighted the socioeconomic disparities and how they are affecting the COVID-19 spread.
Mm-hmm.
And I see that as something which has immediate effects, because policymakers can actually read such things and understand where to make changes and how to make changes. And we try to write the paper in that manner.
Mm-hmm.
In addition, we are trying to work on a model for assessment of immunity based on mobility.
Mm-hmm.
Uh, we haven't finished that work yet, but that's one of the projects we proposed to Volkswagen.
And since the vaccination started, I think incorporating that information to that model will make really useful information for
yes,
for public in the future.
yes, because there are rough estimates as to how many need to be vaccinated.
Mm-hmm.
But if you do a very detailed mobility-based analysis on how many people are coming in contact with how many others, and you basically understand human mobility, as Hyunju mentioned before. You can also understand what is the minimum threshold of vaccination,
Mm-hmm.
because right now, even if there are variants, it seems like the vaccines will work, although there is claims that in one variant it doesn't work so well. But it is not unexpectable that there might be variants for which the vaccine won't work. And if this starts becoming something seasonal like the flu, then it has to be understood as to how quickly you have to vaccinate how many people. And vaccinating 25% is very different from vaccinating 40%,
Mm-hmm.
the time necessary for it. And this might actually be the difference between having to shut things down and not having to shut things down. And these are the thresholds that we are looking for. Of course, science translated into reality is always with a little bit of error bars. But if we have ballpark numbers, that can be perfected later.
Yeah, I mean the threshold to get the to achieve a herd immunity is already known, but what we are looking for is more is more accurate depending on the situation and the areas. Like a county, we will combine this study with, we will combine the population study and other informations to understand that. And that will, we assume that will vary depending on the purpose of the activity. Like for travel, the threshold will be different, and international travel also will be different, or other type of services or opening restaurant. The threshold might be different in a different countries, and yes, so.
Oh, yeah, like variations in cities and small towns or villages. If you have a place where people don't really interact so much, they live far apart, they drive cars, they go to empty stores. The effective threshold for herd immunity is lower. Whereas in a city where everyone's crossing everyone's path, it is typically much higher in such a case. And saying that the herd immunity is 70% for the whole country is glossing over all of these details.
Right.
So maybe you should channel more vaccines in a certain area than another area. So these studies need to be made if this becomes seasonal, because that is going to determine a lot of the logistics for vaccine delivery. And I mean, if a strain is spreading, you don't want the vaccination to take 3 months instead of a month because you distributed it incorrectly.
Oh, I see. Yes, so the distribution for the vaccines is also one possible result of these studies.
Yes,
right.
Of course.
Wow, cool. Yes, that sounds really hopeful. And of course, big new knowledge is now possible and on the way. And I thank you so much for sharing these results and information us, and have good luck, of course, and stay healthy. And perhaps when next year we have another interview, perhaps to another topic, or a possible new result for intelligence or whatever. Thank you so much for this interview, and stay healthy. And I say goodbye.
Thank you.
Thank you.
Thank you.
Bye.